Today in cannabis news, parents and school health experts continue to lobby Colorado state legislators to enact cannabis accessibility restrictions for children. A proposal to protect employees that legally use medical cannabis in Florida stalls in the legislature, and a Louisiana State House committee passes a measure that would regulate and decriminalize cannabis for medicinal purposes. It's Thursday, April 29th, and this is your TRICHOMES Morning Buzz.
Broadcasting live from the TRICHOMES.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up, the Denver Post reports that parents and school health experts in the state of Colorado say that severe cases of cannabis use disorder are becoming more common among teenagers. Representative Yadira Caraveo, a pediatrician who has been pursuing regulations to curb THC potency for months, is their advocate in the Colorado Legislature. They said they're pretty certain they'll soon propose a measure with additional statutes to more tightly control cannabis purchases for medicinal and recreational customers, with an emphasis on restricting youth accessibility. High-potency THC goods are more likely to trigger or exacerbate mental health problems in youths, according to mounting evidence. As per Colorado's own research and a larger trial of 204,000 individuals aged 10 to 24 years published in the Journal of the American Medical Association earlier this year, youths who abuse cannabis have a higher risk of self-harm.
Next up, the South Florida Sun-Sentinel reports that this session, a proposal to protect Florida public employees who use medical cannabis legally has been thwarted, creating a gap among stringent federal statutes and tolerant state ordinances. House Bill 335, which would ban employers from discriminating on licensed medical cannabis users, was submitted to several subcommittees in February, but is yet to be considered. Under existing legislation, federally funded entities such as school districts are required to follow federal statutes prohibiting the use of medical cannabis. Florida employees who are subjected to a drug screening that finds opioids in their system have 24 to 48 hours to offer a reasonable explanation for it. This isn't the same for cannabis, which is classified as a Schedule I substance federally, meaning it has no currently accepted medical use and a high potential for abuse. Heroin, LSD, ecstasy, and peyote are among the other Schedule I substances. The measure was introduced by Representative Nicholas Duran to protect patients who, according to them, are within their constitutional rights to consume medicinal cannabis, as determined by 71% of Florida voters on a constitutional amendment in 2016. This bill really just provides the kind of protections that show and recognize that we do have medical marijuana laws in the state of Florida, Duran said. We treat it as medicine, and we need to recognize that. Though lawmakers and advocates will continue to strive for the proposal's approval in upcoming sessions, many are worried that a Republican-controlled legislature will not extend safeguards.
And last up, WDSU 6 reports that in spite of objections from state police and authorities, a Louisiana House committee passed a measure that would regulate and decriminalize cannabis for medicinal purposes. With a 7-5 vote, House Bill 524, sponsored by State Representative Richard Nelson, passed the House Committee on the Administration of Criminal Justice. 2 additional Republican committee members voted in favor of the proposal. Governor John Bel Edwards, who would be responsible for signing the proposal into legislation, has stated that recreational cannabis is not something they support. Daniel Edwards, their brother, is the sheriff of Tangipahoa Parish, a role that their father, Frank, previously occupied. In 18 U.S. states and Washington, D.C., recreational cannabis is legal. Louisiana is among 36 states where medical cannabis is permitted. Nelson said there is increasing support for decriminalization, adding that they have never personally consumed cannabis. There's a proverb that says no matter how far you've gone down the wrong road, turn back. And I think that's pretty applicable to how Louisiana's marijuana policy is now, Nelson told committee members this week.
That was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit TRICHOMES.com.
And be sure to catch up with all of our other cannabis industry-related podcasts like Hash It Out, Careers in Cannabis, or the International Cannabis Conversation, wherever you get your podcasts. For TRICHOMES.com, I'm David Fortin.
And I'm Devin Leal. Have a great day.